This program is brought to you by Emory University.
We know that on average, we only get about 40% of people well with whatever treatment we start with. And so that the treatment of depression ends up being trial and error in most situations.
Dr. Helen Mayberg and a team of Emory researchers are behind a newly released study funded by the National Institutes of Health. The study examines ways brain scanning techniques might be used to improve how treatments are selected for patients with major depression.
The development of brain imaging techniques, PET scans and MRIs, have revolutionized the way we can study mental illnesses.
And what we're measuring specifically is glucose metabolism. And so what that means is we are measuring how much sugar the brain is using, and you can think of that as how much energy your brain is using.
Their PET data points to a correlation between how much energy is being used in a part of the brain known as the anterior insula and the specific type of treatment needed to help a patient get better.
This is the region where we found...
If their findings are confirmed, baseline activity in this portion of the brain may well serve as a biomarker for how a particular brain type responds or doesn't respond to a particular treatment. Today, over half of those treated for depression still have significant symptoms after completing a standard course of either medication or psychotherapy.
It's not too hard to diagnose depression, but choosing the best treatment for an individual is quite uncertain.
Brain scans were taken before treatment started and then evaluated at the end of a 12-week course of patients receiving either the antidepressant escitalopram or undergoing a type of psychotherapy known as cognitive behavior therapy, or CBT.
So we have 4 groups of patients.
The study compared brain patterns of those who got better with the drug, those who responded well with CBT, and people who had little response to either form of treatment.
You can see that the patients who do well on escitalopram are very different from the patients who do very well on CBT.
If the evidence holds up, this could eventually lead to better recovery rates. Low remission rates have long frustrated mental health care professionals.
To be ill in a major depressive episode any longer than necessary is unsatisfactory. This is a serious illness, and the suffering that goes on can actually have very dire consequences.
A lot of those people are mismatched. They have CBT brains and they're getting medication. They have medication brains and they're getting CBT or some other psychotherapy.
The study brings a new perspective to the way healthcare professionals choose treatment for their depression patients. In the future, doctors could prescribe care based on biological markers rather than relying on their own or their patients' preferences.
To give both treatments is more expensive, is more time, is more demanding. And who would ever want to take a medicine if you actually don't need a medication? They're not benign. And equally, who wants to spend a week with, a weekly session, the time involved for therapy, if in fact that's not necessary?
We can't do it yet, but at some point we envision that people would be able to come in and have this kind of assessment and then be told, well, treatment A is better for your kind of brain versus treatment B for a person with a different kind of brain.
The next step for these scientists is to run experiments where they actually treat patients according to their brain types to see if they can get better outcomes than with conventional selection strategies, as this study suggests.
The preceding program is copyrighted by Emory University.